Hi, everybody, and thank you for joining us. I'm Larry Little, Public Communication Specialist here at the county's Emergency Operations Center. We begin this morning with the focus on the rising number of COVID-19 cases in the county. As you may know, last week, California became the state with the most coronavirus cases in the country. Santa Clara County contributing nearly 2,000 cases in just the past 15 days. Let's go ahead and take a look at our data dashboard here. As you can see, as of yesterday, cumulative of 9,041 cases. 218 of those are new and 184 deaths. Certainly our thoughts are with the loved ones of everyone who's lost loved ones due to COVID-19. We want to take a deeper dive into the demographics here. You can see we are seeing a surge with the age groups for 20 to 29. That's the largest move we've seen. Also with 19 and under. And we see that the largest number of transmissions happen or presumed community transmissions. We want to note here that the death rate begins at age 30. But it's important because anyone 29 and under can contract the virus or be asymptomatic and pass it along to someone who is older and they pass away from the virus. Of course, we don't tell you all of this information to drive fear into you or to close businesses because no one gains from that. But you have to look at this from a risk management standpoint. And you can see here, as we look at our hospitalizations rate, I want to go back to the first slide we showed you here. 175 currently in the hospital. And we go back here. And as I was talking about, is we have to look at this from a risk management standpoint. We have 526 beds total available in the county, hospital beds. Of those, 121 are ICU beds available, 405 non-ICU beds available. And the reason we talk about that, we are in a county of nearly 2 million people, and that's not a lot of beds. So we really have to watch the rate of infection. Here's the information from California COVID Act Now. And it shows that the state of California is at risk of an outbreak. COVID-19 cases are either increasing at a rate likely to overwhelm hospitals or the state's COVID preparedness is below international standards. And you can see here that ICU rooms at hospitals are at 45% capacity. And again, in a state of over 40 million people, we don't have the ICU capacity to handle very serious coronavirus cases. That's why we have such a focus on slowing the spread here in the county and around the state. All right, we are back here, and I am joined now by Mariana Moles. She is Public Communications Officer here at the county's Emergency Operations Center, as well as lead for our social media messaging. You know, I want to bring up this information here. There was of course, our county is on the state's watch list, which places more restrictions on us, as you may know. But someone put a comment last week and they said, I'm moving my business to Santa Cruz County. And a lot of people have said, I'm going to Santa Cruz County to do business. Well, you can see now Santa Cruz County has just been added to the state's watch list, so they're going to be making changes to a lot of businesses that have been open. There's no escaping this virus, no matter where you go, Mariana.
Nope.
So we have to take precaution and follow the guidelines, wear a mask, wash our hands, and everything like this. So what I want to start off, I want to put you on the spot just a little bit, and I apologize. So, we definitely don't want to be preaching to the choir, as my grandma used to say. We want to thank all of the residents who have done everything possible to help slow the spread of COVID-19. But I want to ask you, if everyone is wearing a mask, if everyone is practicing social distancing or physical distancing, as well as washing their hands frequently throughout the day, why are we seeing a surge in the county with COVID-19 cases?
Well, everybody's not doing those things. That's the fact of the matter. We do hear, I just had a friend this weekend message me and say, you know, is there a place for me to report my neighbors who had a party? And I said, hey, just curious, what age group was that? And he said, they're probably in their 20s. I said, okay, that's what we're seeing. We're seeing more cases of people who are in their 20s. Hospitalization rates in that age group are increasing significantly across the country. So people have this idea there's loopholes with this virus. Go get tested. You test negative, that's permission to party. It's not. There's no loopholes with this virus. It's brand new. We're still learning about it. We just don't know enough about this virus.
I want to stand up for the people that are 29 and under for just a moment, because I know it's so easy to say, oh, the young people are causing it. They're not listening. They're not doing it. But, you know, they're not the cause. 2 weeks ago in my neighborhood, the 29 and under were having a party. Well, this past weekend, the 50 and older were having a party. So everybody, we have to do our part. I want to say, ask you, what should people be doing and what information should they be sharing with friends and family?
I think on social media we're trying to reach a lot of different people, and we're trying to meet people where they're at. We know that everybody knows what they should be doing, which is wearing a face covering, maintaining your space, staying in place, not touching your face, washing your hands frequently. But if people can talk to their friends and family about what it means to them when they go out and take a risk, we all have to be comfortable with our own level of risk. But the thing with this virus is if you take a risk, you could also be putting other people at risk who are not comfortable with that risk. So I think talking to our friends and family and expressing how we feel about what they're doing is helpful. But we need to think about this in different ways, and there's different analogies we can use. With the face mask, for instance, it should be as much a habit as wearing a seatbelt when you get into the car. Seatbelt is about safety. One difference with wearing the face mask is that it protects other people. It could save someone else's life if you're wearing it.
And by the way, prior to this broadcast, we did remove our face masks, so everyone, including our American Sign Language interpreters, could clearly understand the information that we would be sharing this morning. So let's talk about face coverings and masks. Why is it important to wear it?
So since the beginning of this, back in January, when we were talking about viruses spreading, one thing that has stayed consistent is that the virus spreads through droplets. And we know this just from other viruses. We know that's how they spread. That has stayed consistent this entire time. The face covering, face mask, cloth mask, whatever you want to call it, it acts as a shield between your droplets and anybody else who's around you, any surfaces that are around you. It significantly decreases those droplets reaching anybody else. And that, combined with the distance, is really the magic piece that people need to keep in mind. Just because you're wearing a face covering does not mean it's 100% all the time foolproof. You still have to have that distance in there, because just us talking, people laughing, those can spread droplets. This isn't just about sneezing and coughing anymore. We are seeing that just people simply talking to each other can spread this virus. It's far more contagious than we originally thought, perhaps, and we will continue to learn more and more about this virus. So are we going to demonstrate?
So I was out and about this weekend running some errands, and I was happy to see people actually, they had their mask, but some of them were not wearing it properly. So you're going to just demonstrate the different things that we have seen and the proper way to wear a mask.
It is a little amusing to see all the different ways that people are choosing to wear their face covering. So just, around social media, we see the analogy of how people wear their underwear. And so that is really quite a good analogy, because you wear your underwear to protect yourself. It's a barrier there. And so when people are wearing their face covering like this is like the equivalent of wearing your underwear and everything's hanging out. That's not doing anybody any good. We don't want to see that. This right here under the chin, again, no. This and then these two things here, that's like the equivalent of wearing your underwear around your ankles or something. That's that's not doing anybody any good. This is not a fashion statement. This right here, this is the fashion statement we want to be making here. And it's a safety fashion statement. It's not just for fun. And so please just cover your nose. You know, it's very easy. It's a piece of fabric. We're not telling you to wear this because we're trying to control you. We are trying to control the virus. That's what this is about. That's what it's always been about. You know, doctors, surgeons, nurses, they've always worn face coverings, face masks. They've worn masks because it protects either you or the person you're around, and so we know this is proven to help. So please wear it properly. It should fit pretty snugly. You shouldn't have any trouble breathing. If you do, you know, take it off, step away from people, take a few deep breaths. I myself have anxiety, and this pandemic has only increased that anxiety, so sometimes I do have to take a moment, take it off, take a few deep breaths, because it can be, you have to get used to it, right? But we should all be pretty used to it by now. So
So, you know, I know a lot of people have a problem with wearing a face mask, but you have to find the good and bad. So people have been creative in wearing some very stylish face masks. And one thing I enjoy is I don't have to go every 2 or 3 days and clip the gray hairs out of my beard or my little beard or mustache.
You know, I don't wear makeup on this half of my face. Get it?
Or you don't have to spend money on lipstick.
Yeah.
And also, it's created another stream of revenue for small businesses. I saw a business on 13th Street the other day, and they had a window full of masks. So we have to look at the bright side of this to get us through this time and slow the spread. So I mentioned earlier that you are in charge of messaging for social media, and the messaging has changed. Talk about it, how it was before.
So in the beginning, you know, as we were learning more about the virus, it was very much, you know, there's no community spread right now, but we need to be washing our hands, don't touch your face. And when we say don't touch your face, we mean in particular, don't touch your eyes, your nose, and your mouth, because that's how the virus is going to enter your body. And, you know, washing your hands consistently, at least for 20 seconds, because the soap combined with the water, it breaks down the virus, and it, you know, essentially gets rid of it off your hands. And so those two things together make a huge difference. And so, you know, we start with very basic messaging, but we're seeing that people are, you know, they're hearing the same thing over and over again, and so we're trying to meet people where they're at and reminding them, you know, since the beginning, this is all about prevention, and that hasn't changed. What has changed is how much we've learned about the virus, and what we have learned is that face coverings and keeping your distance significantly decrease how much exposure you will have.
So let's take a look at some of the recent messaging that we are producing on our social media platforms. This one says, wash your hands like your life depends on it, because it does. Trying to talk about.
Yeah, so that's, we really want to focus on how an easy way it is to keep the virus from entering your body that you have more control over, which is when you're out in public, you know, don't be touching your face covering either. When we say don't touch your face, also don't touch your face covering if you're touching other surfaces in the public, because then it gets on your face covering, and so you want to remove it, you know, without touching anything around it, and really take it off, fold it inside out, you know, lay it there. But when you're washing your hands, you know, you really want to get a lather going, at least 20 seconds. I sing the alphabet song or some other song while I'm doing it, and I have not washed my hands so much in my entire life, because everything I touch, I'm just making sure, because it's just a very easy way to do it, and it really could save your life, because it keeps the virus from you actually introducing the virus into your body. If somebody sneezes on you, you don't have as much control over that, but you do have control over how you touch your face.
So let's go back. We were talking earlier this morning when we arrived here, and you said something that was kind of shocking to me, that you're hearing that people are sharing masks.
We did hear, yes, so two things here. People going to restaurants. One, you should only be going with your household because as we've seen, just spending time with people and not wearing face coverings, that's going to spread it. But we were hearing that people were sharing their face covering like underwear. You don't want to be doing that. You also don't want to be turning your face covering inside out and then using it again without washing it. So just keep going back to the underwear analogy. The virus could be on your mask, so you don't want to turn it inside out. You don't want to share it with other people. Please don't do that. That's all I got to say about that.
All right, let's move on to the next message. It says, you had the sex and drugs talk. Now it is time for the COVID talk. This one is a little bit bold.
Yes. This is for parents who have younger kids in their 20s, teens. This is serious if we don't get a handle on this virus. We have to learn to live with this virus, and being young, you think you're invincible. You want to be rebellious, or you're just sick and tired of staying home and not seeing your friends. Totally understood. But the fact is, like I said, we're seeing hospitalization rates go up for people in their 20s. We don't know all the long-term health effects of this virus. One thing I keep coming back to is people tend to look at this in black and white, which is living versus dying. And it's not only about that. One is, I'm not okay with 2% of the population dying. Neither should you or anybody here. That's not okay. This is not a virus that you want to get and get it over with, because we are seeing that that's not the case. There could be long-term health effects. So it's not just about living versus dying. You might just not get it and then it's over with, like the common cold or something like that.
Yeah.
And so
there's so much
people
about
need to
this.
think about it differently.
Yeah, there's so much to think about here. I mean, you can get the virus, give it to someone else, and they die from it. Also, you can increase the COVID-19 cases in the county, which causes businesses to be closed, people to lose their business, people like me who want to go and visit the business, we can't go. Also, we have to think about our healthcare workers. We will overwhelm our healthcare system if we have so many cases. And we have to think about those essential workers at the hospital as well. So it's not just about you, it's about your neighbor, it's about your community.
And you could be asymptomatic.
Yeah.
At least 25%. I think it's much higher now that they're noticing that it's much higher. At least 25% of people will not have symptoms while they are infectious, which means you could be passing the virus on to anybody and not even know it. Mm-hmm. And that's, we just need to be keeping that in mind. And so we implore parents of young people to have a talk like you would have a sex talk or a drugs talk, because this is, they could get, hurt. They could really have a very severe case of this. We just don't know.
Yeah, and that moves us on to our, the last messaging that we posted here. The majority of COVID-19 cases are people 49 and younger. 95% of COVID-related deaths are people 50 or older. You do the math.
Yeah, so this kind of goes back again to either people under 50 not realizing they're asymptomatic, or just thinking, I'm not going to get it. I'm not going to pass it on to anybody else. We saw the community transmission and unknown rate is the highest percentage of cases. That basically means that people are getting it in the community when they go out in public, when they go to the grocery store, when they go on public transit, when they go into a business. That's what community transmission means. It means we can't trace it back to a known positive case or a close contact.
All right, I am going back here. We are getting a lot of messages from people who are in the personal care services industry, mainly barbers and hairdressers, and there's still a little bit of confusion about why you're operating outdoors. We hope to have more information coming up this week on the program, but I want to let you know that because of the state's watch list, that is why we're operating with the current restrictions. It did not come from the county. As you may know, we were set to open, but we went on the watch list. But so it is because of the state that we are currently operating outdoors for some of those businesses, and others are closed. But I think the main thing here is, there's a lot of focus on what's open, what's closed, if school will start. And if we focus on slowing the spread, that's going to take care of all of that.
Mm-hmm.
So.
Sacrifices.
Yeah.
It's a sacrifice. It really is. It's going to be going on much longer the more that we try to bend the rules, find loopholes and things. I just can't emphasize enough that this is brand new. We just do not know what this virus is capable of.
Mm-hmm.
So don't gamble with it. The virus has not shown all of its cards. We're still learning about it.
Yeah, and there's no way around it. All right, well, I think we'll stop talking about it because I feel emotions starting to come up because we're a little bit tired of it ourselves. All right, I thank you for being here as always.
Yeah, of course.
And thank you for being here as well. And thank you for watching. Stay safe, everyone. Look out for yourself, but most of all, look out for your neighbor. Have a good day.
I didn't demonstrate this one.
Oh, yeah.